What does lung cancer mean today? Anyone can be diagnosed with lung cancer. Smokers, non-smokers, young, and old. One of the major stigmatisms with lung cancer is some people believe that lung cancer is a self-inflicted disease, which is untrue. Why should that matter for anyone fighting for their life? The Lung Cancer Foundation for Young Women is all about advocacy, awareness, education, and logistical assistance. Nicole was misdiagnosed 3 times in a 12 to 16 month period. She was experiencing a persistent cough and being tired all the time. After seeing her first doctor for months, they attributed these symptoms to allergies. She was also seeing a chiropractor for a pain in her right shoulder, which was thought to be from working on her computer all day. Nicole was not improving, so she went to a second doctor who dismissed her symptoms and sent her home. She found a third doctor who was concerned about an x-ray of her lung. He thought that she had mold in her lung and referred her to a pulmonary doctor. This doctor performed a biopsy on the nodules in her lungs, and 2 weeks later, the doctor confirmed Nicole had lung cancer. During her 2 years at MD Anderson, Nicole met many people from across the U.S. and the world who were also fighting cancer. There were stories of families selling their businesses and cashing in their 401ks just to give their loved ones a fighting chance. Nicole saw the need to start a foundation to help other women with expenses throughout treatment. She had the spark and vision of forming the foundation. The statistics for lung cancer 2017 are: over 106,000 new cases are expected. More women will lose their battle with lung cancer than breast, uterine, and ovarian cancers combined. Over 70,000 women will lose their battle with lung cancer, more than the average attendance at an NFL football game. 68% of women diagnosed with lung cancer will lose their battle. Based on the latest 2014 data, the U.S. government spends $6.9 billion on disease research. Only heart disease leads lung cancer in loss of life. 44% is spent on HIV and AIDS. 18% is spent on heart disease. 15% is spent on diabetes. 12% is spent on breast cancer. And only 3% is spent on lung cancer. Early detection is key. It was estimated that Nicole had been fighting lung cancer for 12 to 16 months prior to diagnosis. She was diagnosed at stage 4 with a 1% chance of surviving. Did you hear us say that early detection is key to surviving this cancer? To detect lung cancer early, know your body, tell the physician all your symptoms, ask your physician questions. If your condition persists and you don't believe you're getting all the answers, don't be afraid to get a second or third opinion. Consider the previous stats as just that. There are many factors in fighting lung cancer, and there are new medical breakthroughs in clinical trials on a regular basis. With a little bit of luck and awareness, survival rates will continue to increase. Why logistical support? The annual insurance cost of fighting lung cancer is between $83,000 and $310,000, with an average out-of-pocket expense for low income with Medicaid of $2,116. Medicare with Gap, Advantage, or HMO is $5,976, and Medicare alone is $8,115. And consider out-of-pocket costs have risen 8% annually over the past 6 years. Medicare covers only 80% of outpatient health costs and charges co-payments of $1,000 for each hospital visit. Family expenses add up quickly and are not covered by insurance. Hotel, 1 to 5 week stay can cost between $680 and $3,400. Parking at MD Anderson is $12 per day. Meals, 2 to 3 meals a day can cost around $50. Fuel, depends on how far the patient has to travel. Wigs can cost between $350 and $500. All these expenses are additional costs incurred for their fight for life. After 3 long years, the foundation is finally being recognized by MD Anderson. We are working closely with social services almost weekly. The foundation has provided MD Anderson with prepaid parking tokens and prepaid meal vouchers. We also receive requests for lodging and travel expenses. The American Cancer Society is now forwarding patients to us for assistance. The foundation raises some of its money by participating in events around Texas, Florida, and New York State. We have participated in the Woodlands Marathon, Wicked Wine Run, Turkey Trot, Monster Mash, Neon Dash, Iron Man, the Texas 10 Series, and the Houston Livestock Show and Rodeo Barbecue Cook-Off. We are always looking at new opportunities to offer awareness and fundraising. We are always looking for people to join our team. Thank you to each individual that contributed to assist the women and families fighting lung cancer. Keep checking Facebook for the next LCFF-YW team event. A special thank you to the organizations and corporations that assist and provide funding to the Lung Cancer Foundation for Young Women. Shell Foundation, Cheniere, ConocoPhillips, Energy Transfer, Liberty Pipeline Services, the Ranger Group, Reason to Race, Wicked Wine Run, Iron Man, Texas 10 Series, and the Woodlands Marathon.
Tennessee byway, one arm on the wheel, holding my lover